Hi Sydney, I'm Emily. I'll be your student PT today. I understand that we are doing a little cryotherapy on your knee.
Yes.
And that you had a knee replacement on this left leg.
Mm-hmm. Yeah.
How's everything doing?
Good. Just a little painful.
A little swollen, a little painful.
Yeah.
Well then I think that a cold pack today is gonna be great.
Okay.
Have you been icing at home at all?
Oh, yeah, a little bit.
So you're not new to this process. We are gonna apply a cold pack to your knee after PT sessions. If you decide that this is something that's helpful for you, we can continue to do it. But the cold is it's a pretty superficial tissue, or sorry, superficial treatment.
Okay.
The cold will penetrate through the tissues in your leg, really minimally, but does a lot in terms of pain control, will help with inflammation.
Okay.
We experience decreased blood flow in tissues that have been chilled a little bit, so your body is actually able to kind of come in after the ice treatment, flush some metabolic waste. It'll help overall with your healing, but it'll really help with your inflammation.
Okay.
And allow you to continue doing the things that you're doing and working so hard doing.
Okay.
So what we are kind of concerned about with icing is that prolonged icing and temperatures that are too cold on the skin for too long can cause tissue damage. Are you familiar with frostbite at all?
A little bit. Yeah.
So that takes about an hour at certain temperatures to set in. We're not gonna get anywhere near to that. We are going to be looking at maybe 10, 15, 20 minutes of cold application, just mostly for that pain control and that inflammatory response, mitigation of the inflammatory response. And in reviewing your history and looking at your intake forms, you're not currently experiencing any cardiovascular concerns, nerve injuries, acute wounds outside of your knee replacement.
No.
And then in the shower, are you feeling the difference between hot and cold temperatures?
Yes. Yeah.
Right. Have you ever had any adverse effects of icing at home? Those would look like, you know, skin changing color and staying kind of blanched for a while, increased pain at sites of ice application, any nerve issues?
No.
No. Great. Is it okay if we apply an ice pack today? Great.
Yeah.
I'm just gonna put it in this pillowcase. I've gotten it a little damp, so it'll help that cool penetrate a little faster. But we don't wanna ever have ice directly against the skin.
Okay.
Sydney, are you ready for your ice pack?
Yes.
Great. Does that feel okay? It's not too heavy on your knee? That's great. I'm gonna give you this bell.
Okay.
And I'm gonna come back and just check on your skin in about 5 minutes.
Okay.
To make sure everything's going okay.
Perfect.
Okay.
Thank you.
Doodly-doo, doodly-doo, doodly-doo. Sydney, it's been about 5 minutes. How are you doing?
Good.
Does everything feel okay?
It does.
Okay, I'm just gonna check
good.
on the color of your skin. Do you feel this pressure?
A little bit. Yeah.
Okay.
Yeah.
Is it okay if we leave this on for about 10 more minutes? And then you have the bell if you decide you're done.
Okay.
Great.
That's good. Thank you.
I'll be back. Doodly-doo, doodly-doo, doodly-doo. Okay, Sydney, it's been about 15 minutes, maybe 16 minutes. How are you doing?
Good.
Leg feels good?
Yeah.
Okay. Okay, our skin is still red, so that's great. How are you feeling that?
A little
pressure?
numb.
A little numb?
Barely, yeah.
Okay. I think for today that's probably enough for this treatment.
Okay.
And then I have a pamphlet for you that'll teach you how to make kind of a gel pack at home if you'd like.
Sure.
It's a water isopropyl alcohol ratio, and it tends to be pretty easy and nice for home use.
Cool.
Think about how you're feeling for the next couple hours, and then we'll talk about whether this is something you want to integrate more often.
Cool.
Thank you.
Thank you. Such a good therapist.